Have you heard about weight loss pens? The pens for obesity and weight reduction? In this video, I'll tell you all about them. I'll focus on the risks nobody talks about. And why am I discussing this? As an endocrinologist, I work with these meds often. By meds, I mean GLP-1 analogs specifically. They're sold as Saxenda, Victoza, Ozempic, and Wegovy. Have you heard of any of these names? Probably yes. They're the most famous, most talked about pens. Let's understand a bit about them. You'll be surprised by what I'll say now and later about the risks. Did you know these names only cover 2 active substances? For instance, Victoza and Saxenda are the same drug, just different doses. What is this medication? Liraglutide. So Victoza has liraglutide and so does Saxenda. So they're actually the same substance. People often say, I didn't do well with Victoza, I'll switch to Saxenda, or Saxenda didn't work for me, I'll try Victoza. In reality, they're the same substance and are made by the same company. Many think, I don't like this brand, I'll switch to another. But it's the same company producing both. So that approach won't work either. What about Ozempic and Wegovy? Many say Wegovy is the new miracle, when actually Ozempic is the same as Wegovy. The only difference is the dosage. Ozempic has a lower dose, while Wegovy has a higher one. The lower dose is for diabetes to reduce blood sugar. The higher dose targets weight loss, not just for diabetics, but also for obesity. So that's the main difference. Does that make sense now? Is it clear? Surprising, isn't it? I bet so, as many people don't know this. What's the active ingredient in Ozempic and Wegovy? It's semaglutide. Victoza and Saxenda share one substance, while Wegovy and Ozempic share another, just with different dosages. How do these drugs work and what's not commonly known? The last risk, number 7, is one of the most harmful and common. It's a major issue during treatment. How do these medications function? They work in various ways, but I'll focus on 2 main aspects. First, they act on the intestines and stomach, slowing gastric emptying. This means food stays in your stomach longer, delaying gastric emptying. This leads to increased feelings of fullness. These drugs also affect satiety in other ways. What's the issue for many who overeat? They struggle with feeling full. It can help with satiety and gut health, which enhances this effect. A full stomach means you'll feel more satisfied and eat less. That's basically how they work. But what are the risks of this medication and drug class? We're talking about GLP-1 analogs. As an endocrinologist, I've listed 7 risks I'll explain and comment on, including how to avoid them if possible. The first risk, a contraindication, is for people who've had medullary thyroid cancer. It's the 3rd most common type after papillary and follicular thyroid cancers. Medullary thyroid cancer comes next. This also applies to those with a family history or genetic syndrome, increasing the risk. Why is that? Why is it contraindicated? Because studies in rats and rodents showed this cancer type became more frequent. In humans, it's unclear, but it's a red flag. Even without proof of increased risk in humans with a history, it's defined as a contraindication as a precaution. This applies to those with this thyroid cancer type, family history, or known high-risk syndrome. But why not do a human study then? To take people who had cancer and test them, because you can't do a study like that. Take people and see when they'll get cancer. It's not possible, right? First, no one would volunteer, and ethically and medically, it's not feasible, okay? So, given this suspicion, it's a contraindication. Many claim it's any thyroid cancer that increases risk, but that's also false. I'm warning you from a medical standpoint, it's this specific type with a history. Got it? Understood? Oh, your like is appreciated. If this info helped and you like the explanation, a like is worth it. Let's aim for 10,000 likes so the system sees it as relevant and shares it more. If you're not subscribed, hit that subscribe button for more videos like this. The second risk, which is also rarely discussed, is the risk of eye disease. Wait, what? I'm using a pen to lose weight and there's a risk to my eyes? Here's the deal. For people with high blood sugar and diabetic retinopathy, rapidly lowering blood sugar levels can worsen their eye condition. So those with diabetic retinopathy and high blood sugar levels risk worsening their condition if they use this medication. Note, This risk isn't specific to this drug. It's the rapid drop in blood sugar that can worsen eye disease. Oh, so that's why the doctor said to lower my blood sugar gradually? Exactly. So if you have diabetes and are starting this medication, it's wise to see an eye doctor to check your eye health. Got it? This effect doesn't occur in those using it for weight loss who have no blood sugar complications. Understood? Same as I said in the first danger, often you get info from someone who's not a doctor or endocrinologist saying it can cause eye disease. In reality, it's not quite like that, but caution is needed, especially for diabetics. Agreed? The third, less discussed danger is the risk of acute pancreatitis. What's acute pancreatitis? It's pancreas inflammation causing severe pain, fever, digestive issues, intense pain, nausea, and vomiting. So be alert to these symptoms. If they occur, talk to your doctor quickly. Studies on these weight loss pens gave this warning. Those with a history of pancreatitis should also be cautious. As we saw, the last two could be prevented with monitoring, but what about these? Should you get pancreas tests to check for inflammation like pancreatic enzyme tests? The answer is no. Studies show liver enzymes can't predict this complication. As a doctor, I assess if one's history increases pancreatic risk. But if you don't have symptoms, there's no need to keep testing pancreatic enzymes to see if they're elevated. Scientific studies show these drugs can slightly increase pancreatic enzymes, but it's not clinically significant. It'll just scare you. Oh no, my pancreatic enzymes are rising. Studies show we can't predict or prevent this, but do watch for the symptoms I mentioned in danger number 3. Number 4, pay attention. These meds can harm pregnant or breastfeeding women. Without safety studies, it's not recommended. Many women use these weight loss pens without realizing the risk to their baby. So this requires great care. As a doctor, I'm cautious about prescribing such medication to women of childbearing age trying to conceive. It's contraindicated. If you're trying to conceive or at risk, discuss with your doctor. It can harm pregnancy or breastfeeding. Without safety studies, it's not worth the risk. We always err on the side of caution. This caution is crucial, and it's a danger I had to mention. The fifth danger, also requiring care, concerns exams for those using or planning to use weight loss pens. Did you know it can increase risks in some medical tests? Remember how I explained it slows gastric emptying and reduces bowel movements? So if you're having a colonoscopy or upper endoscopy, you must inform your doctor that you are taking this medication before the exam. Why? It can increase complication risks, as we know this effect, okay? So exams that can interfere include colonoscopy and upper endoscopy. They may increase complication risks, so be cautious. Risk number 6. But before that, you might wonder, what about hypoglycemia, nausea, and vomiting? Hypoglycemia isn't an effect I'll highlight here. Why? For non-diabetics using only these meds, low blood sugar is very rare. When should we worry about hypoglycemia? When you're on insulin or meds that affect insulin production? In those cases, combining drugs can increase hypoglycemia risk. But studies show it's safe for diabetics when used alone. Nausea and vomiting are known, even expected side effects. Up to 50% may experience nausea or vomiting due to this effect. I won't list it as a danger since it's common knowledge. I hope you're aware that this can happen. It's indeed very common. Danger number 6. These meds can increase heart rate. In some cases, this might be contraindicated. For patients with tachycardia or heart rates near 100, as an endocrinologist, I'm cautious about starting these medications. Studies, especially with liraglutide, have shown potential increases in heart rate. If you already have elevated heart rate or are treating related issues, then yes, it's a concern. This known side effect could worsen your condition, okay? So, you also need to be careful with your heart. You should monitor your heart rate closely. Even with cheaper versions and more producers, these drugs aren't the miracle cure some claim without knowing the facts. The 7th danger, in my view the most harmful, is that many patients mistakenly see these drugs as the main pillar of treatment. In reality, they're not. These medications can help, but they're not the main pillar. They don't replace a healthy diet, routine sleep, or exercise. Those are the main pillars. If you use the medication but don't focus on the essentials, what happens? Many regain weight after stopping, sometimes more. Blood sugar often worsens. Some on long-term treatment need higher doses. Why? If you have high blood sugar and don't make lifestyle changes, the disease naturally tends to progress, increasing your blood sugar levels. If you don't address this, you risk the medication becoming less effective over time, requiring higher doses. It's crucial to understand that medication isn't the main solution, but rather an adjunct that can help in some cases. I'm not against medication. In fact, I often prescribe it when properly indicated. However, using medication without medical guidance is extremely dangerous. If you're using or considering medication, remember it's not the primary treatment, but an aid. If you're diabetic, it's vital to understand proper nutrition. What are the best and worst foods to eat? I've made a video on this topic that I recommend you watch to learn more. As you've seen, there's no miracle cure, just knowledge. Watching this video will help you better understand and control your blood sugar levels.